To begin with, I will proceed with the history of the Royal Melbourne Hospital. So, in the early 1841, a group of community-minded people unite out to provide crucial medical services to the residents of the rapidly developing village located in the humble cottage. They have named the hospital as a Melbourne Hospital, and after having the transformation of an era and surrounding, they renamed the hospital with the Royal Melbourne Hospital by the Royal Caterer on 27 March 1935. What interesting about the Royal Melbourne Hospital is actually they have an archive. The archive called as Archive of Royal Melbourne Hospital. As we know, the hospital actually have been operated for a long time, so they have many valuable records. So by maintaining the hospital culture, legacy, and distinct character, the archive serves as a corporate memory. So the archive will reflect the political, social, and also cultural influence that shaped the hospital history and chronicle his hospital policies, and also helping them in decision-making process at the highest level. The goal of this archive is to support the hospital various business, educational, research, and patient care activities, including the administration needs, educating staff and students about the hospital tradition, provide a sense of identity to the hospital community, and supporting the public affair, fundraising, and community engagement campaigns, and most importantly is to providing the research service. Now we proceed with the administrational archival matter activities. The first activities is of course the acquisition and collection. This activity actually will tell us about how we get our resources to our collection, right? So there are several methods to acquire the collection, such as purchase and exchange record. But for the Royal Melbourne Hospital, they are mostly get their collection through their donations from the past and present staff, student research, and also patient records. The major holdings of this archive actually such as minutes and paper of the boards of management and communities of the hospital and network, correspondence of the chief executive officer, their annual reports, and etc. So mostly they are archiving any of record that related to their fields and also their collection. That's all from.
Alright. For the next activities in the Royal Melbourne Hospital is appraisal and disposal. For in these activities, these archive are not control any records or document after 1910. However, they are still allowing the user to access the previous records. That means before 1910. They are not because they are not received the latest records. Okay. For some of the records, they are already transferred to Public Record Office Victoria. That is patient records from 1856 until 1910. As I mentioned just now, they still have some records they keep their own stuff. That is the incomplete records. The incomplete records, that means some of their records are only contain the date of their discharge, or some of their records not contain the reason why the patient admit. So but the records still have the information about their patient, so that is the reason why they still keep the records. Then the activities is accessioning. For the Royal Melbourne Hospital archive, they need to follow a policy. Firstly, is they should know the purpose of their archive or records. They should know the objective and why they keep the records or why they need to transfer it to the public archive. Secondly, is what it collect. The topic, because I believe this archive not only keep the medical records, they also keep the organization of the hospital records. And then is last but not least is the user of the archive. They should know the user of the archives. That means they have their target audience, such as like doctor or students or other researchers. Because I think these records, even it's medical records, but it doesn't mean it's specifically only for the students or for doctors. Some of the people also have need these materials for their research.
Let's move into the arrangement and description.
The Royal Melbourne Hospital in Park Village provides a comprehensive range of health service across the campus. The Royal Melbourne Hospital provides general, especially medical and surgical acute services. Sub-acute services including rehabilitation and aged care, outpatient and community programs are provided from our Royal Park campus. So as you can see, there is the level of arrangement and description of Royal Melbourne Hospital Archive. There are level and example of the arrangement and description. The first one is institution. The example is Royal Melbourne Hospital Archive. The next one is group, and the example is Ministry of Education, followed by subgroup. The example is executive team, and the last is fire unit, and the example is Victoria Public Record Act 1973 and the former Mount Royal Hospital. Next is preservation and storage. The Royal Melbourne Hospital collect information such as name, address and contact details, as well as information about your health problem and the treatment that you are given. The information is added to record every time attend or have contact with Royal Melbourne Hospital. The Royal Melbourne Hospital collect and maintain personal and medical information in order to provide you with appropriate care and treatment. The information that RMH collect during visit is stored securely in electronic medical record, also known as EMR system. The Royal Melbourne Hospital comply with the statutory requirement. The Royal Melbourne Hospital comply with the statutory requirement for information retention according to the Public Record Office of Victoria. At the end of the retention, securely destroyed. So generally, inpatient records are kept for minimum of 15 years after the last attendance or until the age of 25 if the patient was a child while receiving treatment. Outpatient and emergency department records are kept for minimum 12 years and up to 20 years from the date of the patient attendance. For psychiatry, inpatient and outpatient records are kept for minimum 25 years or until the age of 43, whichever is the longest one. In radiology image are kept minimum for 5 years after creation, and the last one, the record of disease patient are kept for 12 years from the date of death. So that's all for the preservation and storage.
Now, I will proceed with the access and reference services. The definition of access brings the meaning that the implementation of policies and procedures rules the access and use of archival records by employees of the archival organization, which owned by government or public. The staff have the responsibility to make sure the rules are obeyed. The researchers will get a copy, a set of the rules, then must apply for a reader's ticket, fill in application form and attendance register. The access activities at the Royal Melbourne Hospital, the people who want to access through appointment only. The requirements such as advance notice of the visit, and for the initial visitor can sign in the access agreement form. The reference services at archives institution are available when the researchers make contact and search department by email or correspondence in person and by telephone. The reference services are available in the search room, which is this area should be accessible, speedy service, given with good advice. The archival institutions need to manage outreach program in order to attract wide people about the cultural heritage. The Royal Melbourne Hospital, through their historical publication that deliver the story about the campus, services and their people, which have gained support to that organization. Meanwhile, online photographic exhibitions titled such as First in Care, and the second one are Theatre and Surgery, and many others.
Moving forward to another content, we will go to the SWOT analysis. The first one is strengths. For the first one, they hold many collections. Like previously stated, the Royal Melbourne Hospital have records in the archive, the collection that the archive hold that includes minutes and paper of the hospital, and network board of management and committees, and so on. This proves that this archive is functioning as well as the other archive. For the second one, information technology is on the rise. People all over the world have been influenced by the IT boom in a variety of technical and industrial fields. And the situation in the healthcare industry is no different. Doctors and Medical professionals have been introduced to the digital world, allowing for digitization, automation, and organized storage on a virtual platform. Thus, the Royal Melbourne Archive has taken this advantage to change the way the archive works. For example, the process of viewing records can be done online with regulation and permission. The third one is strategic digitalization. For a few years, the hospital have been on the road to digitalization. Various departments, including pathology, radiology, cardiology, emergency, and others have established electronic clinical databases in an attempt to eradicate paper. It is to benefit from the advantages of working in a digital environment. So for the next one, we will go to the weaknesses. First, significant amount of information technology sprawl. While the hospital had converted a significant amount of data to electronic format, it was not reaping the many benefits that come with the digitalization. The hospital, like many healthcare organizations that take a piecemeal approach, had a lot of information technology sprawls. The second one is electronic databases that are scattered. It was often difficult to identify and use detailed information with these dispersed electronic databases. Complaints will come in because they couldn't find paper records. The third one is restricted access. The public has limited access to patient medical records, while the archive has control of patient medical records from 1856 to 1910. Some original volumes of patient records from this time period have been sent to the Public Record Office, Victoria. Next, we'll go to the opportunity. The first one is potential of influencing decision making and streamlining processes. Clinicians have access to an extensive view of heretofore scan records, as well as access and coded information from the patient administration system, such as alerts and allergies. The second one is converting paper-based. The technologies allow for the conversion of paper-based operation to more efficient electronic workflow. The last one is we are talking about the threat, which is the security matter. Medical records are valuable to some of people, especially that related to important people, as the Royal Melbourne Hospital has so many types of patients that include rich people. By that, hackers will see the opportunity to hack into the hospital system to find the records that give value to them. This is because, as mentioned before, the archive has implemented digital way to store records. This will become the threat to the Royal Melbourne Archive.